are most welcome, ladies and gentlemen, to Real Impartation Moments on Tuesday Night Anatomy with Daniel Okwan. Today's section, we are still in the area of neurovasculature. And an important concept I want to convey to you today is blood flow during fetal life period. Okay, an intrauterine life period blood flow, that is what we want to discuss today. And that is something simply we call fetal circulation. So my friends, at the end of this meeting, I want you to understand the complete picture. You should be able to close your eyes and then tell us all that you need to know about the fetal circulation. That's number one. Now number two, you need to know the major components of this fetal circulation and what happens to these components postnatally. Because my friends, after extrauterine life period, most of these components of the fetal circulation will not have any use. So what happens to them? Okay, we want to understand these things, okay, in the postnatal period. My friends, before I go on and draw these things for you for your comprehension, one thing I want you to understand is that as far as the fetus is concerned, the blood that is flowing through it, okay, the red blood cells will carry a special type of hemoglobin. And my friends, that is something we call the fetal hemoglobin, simply hemoglobin F. Now, precisely for efficient fetal blood flow, this hemoglobin F has some peculiar characteristics which ensure efficient blood flow, okay, and blood supply to the fetus. And what are these important things? I want to highlight a few of them to you so that we can begin. The first important thing I want you to know is that this hemoglobin F, unlike what happens, okay, postnatal, eventually to be replaced by something we call hemoglobin A. That's the adult form of hemoglobin. Unlike the adult form, hemoglobin F has a very high affinity for oxygen, regardless of the partial pressure of oxygen in the environment. Yes, I want you to know that. So what it means is that irrespective of how low the oxygen in an environment is, okay, the oxygen will obviously bind to this hemoglobin F preferably. Okay, I want you to understand that point. The next thing is that, so in doing that, it will ensure that at any time t, we are able to get oxygen binding to this hemoglobin F to be transported to, of course, the fetal cells. However, one thing I want you to understand is that because of the spurt of growth, okay, there's high metabolic rate activity, okay, taking place, okay, in the cells of the fetus. So it means that at any time, at almost any moment, what happens is that the oxygen level, okay, in the fetal cells is low. My friends, if this hemoglobin F gets to the cells of the fetus, okay, as I told you, regardless of what we call the partial pressure of oxygen around, the oxygen preferably will bind to hemoglobin F. But my friends, it doesn't happen in the case of the fetal cells. So although there's relative hypoxia at the level of the fetal tissue, when hemoglobin F gets there, it doesn't take the oxygen away, no. Rather, the oxygen that the hemoglobin F was carrying, getting to the level of the tissue, it will rather unload it. So what I want you to know is that preferably it unloads oxygen to the tissues of the fetus. Okay, so that's one thing I want you to know. Now, having looked at these things, then we have enough information to begin something we want to talk about today, and that is the fetal circulation. Fetal circulation. Of blood. Good. So we are looking at the blood flow in intrauterine life period. Now, for you to really understand this concept, one thing I want you to know is that there are some key components I want you to know for now. Yes, I want you to become aware for now. Now, the first thing is that we have something we call ductus venosus. ductus venosus. I want you to just get these things for now, and I'll be going to the whiteboard. Ductus venosus. Now, whenever we talk about fetal blood circulation, we are talking about blood circulation which makes use of shunt system, okay, bypassing some areas, okay, to ensure effective blood flow. Okay, ductus venosus. Now the question is, why do we need this ductus venosus? We want to ensure that we, to a very large extent, we bring to the barest minimum the effect of first pass metabolism on the components of the blood that is going to the fetus. Yes. So what do we mean by first pass is that in the liver, a lot of things will take place, okay, so that the bioavailability of the molecules, okay, that is supposed to get to the fetal cells will get reduced. So we want to bypass that. That is why significantly we need a channel to take away most of this blood. In fact, I'm talking about oxygen-rich blood from getting to the liver, okay, through a system which we are calling it, the ductus venosus. Now, just think about it. Now, from the liver, we are taking it to, if you look at the gross anatomy viewpoint postnatally, you see that from the liver, through something we call hepatic veins, the blood will get into what we call the inferior vena cava. But this time around, we don't want to go to the liver so much. We want to bypass it and then go straight into the inferior vena cava. And that is through that bypass system, which we are calling it ductus venosus. I'll be coming to these things. That's number one. Now, the next bypass system I want you to become aware, okay, is something we call ductus arteriosus. Ductus arteriosus. Now, my friends, this time around, the fetal circulation is there for the reason that the lungs are not fully mature enough, okay, to get that stress, that overload of blood circulation. So we cannot deal with it so much. And that is why significantly, most of the blood, which we expect, that from what we call the right ventricle, we are supposed to pump this blood into what we call the pulmonary trunk. And then of course, from the pulmonary trunk, it's supposed to get to the left and right pulmonary arteries, and eventually to the lungs. But we are saying that the lungs are not fully functional, they are not fully capable to handle the stress, okay? And so what will happen is that through something, we've discussed these things already. When we looked at the development of the arterial system, I told you that in the sixth arch to the left, we don't only have the left pulmonary artery, but we also have ductus arteriosus, okay? So that it's going to connect the arch of aorta to mainly, we are talking about the left branch of what we call the pulmonary trunk, and that's the left pulmonary artery, okay? So that is another point. So that's the bypass system. We don't want it to get to the lungs so much. We want it to, yes, eventually it will come down. We are going to see that. Now, the third component I want you to know, there's another shunt system. The third shunt system is that in the wall of the right atrium, if you go into that chamber, what will happen is that it's supposed to, from the right atrium, the blood is supposed to come down into what we call the right ventricle. But we want to ensure significantly that most of the blood will not get to the right ventricle. And that's why I want to bypass. Now, I want to move straight from the right ventricle right atrium into what we call the left atrium. And you know, there's going to be a foramen over there. And that is something we call it, foramen ovale. Foramen ovale. We are going to see that. So that's a third shunt system that I want you to become aware of. So my friends, having known these things, then we have enough grounds to draw and of course explain this concept to you for your comprehension. So you draw it exactly the same way I'm going to draw it. So I'm going to begin with sketching something related to, let's take something like, we have the heart, okay, schematically, let me just say this is the heart, okay. Now if you look at the heart, we are going to have some chambers. Let me say these are the upper chambers, okay, and then from there through the valves you go to the lower chambers. Of course, we are going to have all the septum, the interatrial, interventricular septa, okay, will be there. Now, what I'm interested in is that I'm interested in the cranial portion over here. That from this right ventricle, let me make it this way. I will see it. From this right ventricle, we are going to see that I'll have this. put it this way. And then also from this left ventricle, okay, what we see is that okay, so what I'm trying to demonstrate over here is that I will see now this is the arch of aorta. Okay, now initially, yes, we are going to have the ascending aorta, then it arches, then it goes down as descending thoracic aorta. Okay, eventually getting to the abdominal aorta. Now what I'm interested in showing you is that over here from, let me put it this way. Of course, we know that from the arch of aorta you have, yes, those that B, C, S branches will be coming from it. Okay. Now, whenever I talk about the BCS, I don't need to explain much. Of course, these ones will be left. Okay. We know those three main arterial branches coming from the arch of aorta. From right to left, we have the brachiocephalic trunk, we have the left common carotid artery, and of course the left subclavian artery. That's what we see. And then also this guy over here, this is what we call the pulmonary trunk. This is the pulmonary trunk. I'll come to this pulmonary trunk again. Okay, so this is the pulmonary trunk. And then the pulmonary trunk, okay, pulmonary trunk. And then it gives us our left pulmonary, sorry, that's the right pulmonary artery. And of course, this guy I'm trying to draw over here is actually the left pulmonary artery. Okay, so we just need to understand this. Now, there's going to be already, I'll come back to these things, but I want you to understand it from this viewpoint. Now, there is a connection, okay, between this arch of aorta, and of course, a branch of this pulmonary trunk, actually to the left pulmonary artery, okay, left pulmonary artery. So this guy over here, there's going to be a connection, and my friends, that connection is one of the shunt systems that we are talking about. That connection is one of the shunt systems we are talking about. Okay, over here, connecting the arch of aorta to the left pulmonary artery. And so this is the one that we took, because we are looking at arteries, it becomes a ductus arteriosus. A ductus arteriosus. So this one, I wanted to put down over here that this is the ductus arteriosus. And I want you to highlight this guy because it's one of the important duct systems that I want you to become aware of. Ductus arteriosus. So when we ask you, what is the role of this ductus arteriosus? Your answer is simple. That it shunts blood, okay? It shunts blood from where? We are talking about from this left pulmonary artery, okay, to, of course, this, arch of aorta. Now, mainly, we talk about pulmonary artery, and then we know that it is going to carry oxygen poor. So, this one, I may make it bluish a bit, okay, to be carrying this kind of oxygen poor blood. Okay, so let me make it bluish a bit. Okay, and I'll explain it. Okay, so that is that one. That's one of the shunts. Now, so this blood will come down, okay, as we see. Descend thoracic aorta, eventually coming, of course, this abdominal aorta. And my friends, at the level, you know that, in the adult, at the level of, L4 vertebra, what we see is that it divides. And when it divides into left and right common iliac arteries. Left and right common iliac arteries. And one thing I want you to know is that even this, the name is common because it will further divide. Okay, the name is common because it's going to further divide. And one thing we know is that, yes, this one becomes your external iliac artery, which beyond the inguinal ligament, we call it femoral artery. And then this guy over here going is inside, so it becomes internal iliac artery. So this one over here becomes your right internal iliac artery, and then this one becomes your left internal iliac artery. Now, this is where I want you to become aware of an important thing. Now, the blood will be coming eventually. Now, look at it. It's oxygen poor. I've dotted this area with the blue marker. Okay, it is having some kind of oxygen poor thing. Now, it got blended with what we call the arch of aorta. The blood is coming down. So, what will happen is that to be distributing the blood gradually. Okay, to distribute the blood gradually from the cranial region, and as it comes caudally, what happens is that the degree of deoxygenation will be increasing. Okay, and then eventually to also be taking all those oxygen poor things. So as it comes down toward the lower limb, what happens is that the degree of oxygenation will be going down, becoming oxygen poor and poor. And so what is going to drain this oxygen poor towards the placenta for further oxygenation? And my friend, it's going to be through a branch of this internal iliac artery. Okay, we are taking it to the placenta through the umbilical cord. So who is that guy? We are talking about this, the artery. Okay, so we are talking about the umbilical arteries. Remember, we have left and right common iliac arteries. So for this reason, we are going to take oxygen poor. Okay. Okay, so I want you to draw it exactly the same way. Okay, so oxygen poor. Okay, so that is why I have this blue thumb demonstrating that for you. Good. Now, eventually, where are you going to? As I said, we are getting to the level of the placenta. Yes. So, assuming I say this guy over here is the placenta, okay, let's take that this is the placenta. Now what we see is that the placenta, okay, so this guy will be coming all the way and then coming into, of course, this placenta. Okay, at the level of something called chorionic villi. Chorionic villi. Now, okay, now the placenta too, one thing is that it is not only going to give us, it's not only going to receive these, left and right. Now I want you to know about this one. I'm talking about these guys are the left and right. Okay, let me put it here. Left and right. Umbilical arteries. Left and right umbilical arteries. Remember that is also an important bit. It's not part of the shunt, so let me put this one in this box. Okay, left and right umbilical arteries. Okay, let me put it in a box. Now the shunt, I'll use that one to demonstrate it. So it comes at the level of what we call the placenta, at the level of the chorionic villi. Okay, for that, bringing the oxygen portal. And remember that it is also, okay, that filtration, whatever is going to take place over here. Okay, the waste and all that to be taken to the mother's circulation. Now, how about the oxygen-rich blood coming from the mother? Okay, so when it gets here through another artery, so this time we are talking about a single vein. It's not an artery, it's a single vein. I want you to know that. Now remember, although these are arteries, because at the lower limb, okay, we see a lot of oxygen portal. That is why I'm using blue. So one thing too is that now usually we talk about extrauterine life period, and we say that the only, artery which carries oxygen poor blood is going to be the pulmonary, arteries. However, in intrauterine life period, we have also this guy, the left and right umbilical arteries, carrying oxygen poor blood. But carrying oxygen rich blood, okay, is rather going to be what we call this guy over here, which I'm calling it the umbilical vein. Now, if you pay attention, you will see that unlike the umbilical arteries, which are two, the umbilical vein, we see a single one. Now, the question is, are we talking about the left or the right umbilical vein? Now, last 2 weeks, I explained to you, looking at the development of the venous system, I told you about the primitive veins, and I brought in the left and right umbilical veins. I told you that very early, okay, that of the right umbilical vein gets degenerated, okay, it regresses very early, but the left one is left. That's what we told you. Okay, so what we see is that this guy over here is actually the left umbilical vein. It's a single umbilical vein. So in even real-time sections, okay, of the placenta, okay, looking at the umbilical cord, when we cut through it, in the cross section, you will see a single umbilical vein, and that's actually what we call the left umbilical vein. Okay, so what we see this guy. Now, what I want to bring in another thing. I want to draw the liver also over here. Now, assuming I have the liver, let me just sketch out something briefly. Let's take it that this is the liver. Let me make it this way. It's going this way. This is the liver. So as far as the fetal circulation is concerned, the three important organs I want you to become aware is the heart itself, the placenta, and of course we bring in the liver also. Remember that I told you that I have to also bypass the liver. Okay, significantly I want to do that. So this artery, okay, this vein, umbilical vein, is going to the liver. But one thing we see is that from the lower portion, okay, we see that of the inferior vena cava to coming in. Now I will use this one to continue with it and explain. Okay, it's coming all the way into this area. Where is it going into? It's going into that of the right. Okay, so there's the right atrium. Okay, so from the lower portion, it's coming in here. Yes. Now, one thing I want you to become aware that, let me even take it a bit further. Okay, so it's coming in here. Okay, so this is what we call the inferior vena cava. Okay, so one thing I want you to follow is that this umbilical vein eventually has to come to the liver, but significantly it will bypass it. Okay, and then of course it will come here. It will bypass it and then come here. Okay, so this is through a shunt system. Okay, this is also one of the shunt systems I want you to become aware of. Okay, so the blood will flow in this manner. Okay, now this one is coming from below. Okay, so this is what we see over here. Now, this one will continue. Yes, it's getting towards where the liver is. Okay, let me separate this into left and right lobes on the liver. Okay, now this is the one I want you to become aware that we are looking at what we call the ductus. Now look at it. this time around we are not talking about the arteriosus, no. This time it was through what we call the umbilical vein, the left umbilical vein, and then we are coming this way. So we are not going to call it ductus arteriosus, no. This time around it's the vein. We are talking about the vein, so it becomes ductus venosus. Okay, in this manner. So that is also one of the shunt systems I want to become aware of. Ductus venosus. Now, one thing we will see is that yes, it will still continue as the umbilical vein and get to the liver. But one thing we will realize, okay, is that also from below over here, let me put it over here. There's another vein. Okay, from below coming this way. Okay, and then join the terminal portion of this left umbilical vein into the liver. And one thing you will see is that this one is rather carrying oxygen poor blood, but however, it is carrying nutrient-rich blood. Okay, although it's oxygen poor, it is nutrient-rich. Okay, all the nutrient from the intestine and wherever which have been absorbed. Okay, and so this is the one that we call the portal vein, hepatic portal vein. So the terminal portion of this left umbilical vein is joined by the hepatic portal vein, okay? And eventually everything gets to the liver. Remember that although I'm saying it is oxygen rich, it is nutrient rich, okay? Then it gets here. So one thing I want you to know is that although I was saying that you need to bypass the liver to minimize the effects of first pass metabolism, so that what will get into systemic circulation in the blood of the fetus, okay, there will be high bioavailability. What is happening is that yes, most of the blood is shunted into the inferior vena cava this way, so that eventually gets to what we call the right atrium. What we see is that some portion will get to the liver. Yes, because after all, you know, the liver is also an organ which requires nourishment. Remember that it's a very important site as far as metabolism, okay, is concerned. Okay, so this is what we are going to see. Now, the next thing is that after everything, what we are going to see is that this, okay, when it gets here, it doesn't spend much time over there. So yes, essentially, the availability, yes, some way, somehow, you're able to get some of the, the content. So what will happen is that through something this time around, so it will not be purely deoxygenated, no, there will be some bit of oxygenation in it. Okay, so it will come in this manner. Let me put it this way, the liver. Now from here, yes, so eventually it is coming into, of course, the terminal portion of what we call the inferior vena cava, still inferior vena cava. Okay, and this is something that we call, okay, is a hepatic vein. Hepatic vein. Okay, so the point here is that we ask you that, you know, the hepatic veins are also tributaries of what we call the inferior vena cava. They are post-formative contributing tributaries of the inferior vena cava. That's something we see. Okay, so from here, as I said, we won't spend my time over here. So there are a lot of nutrients over here and some bit of oxygenated blood. Okay, so that's why I'm using red. And it will also drain the contents, okay, into what we call the terminal portion of what we call the inferior vena cava. And that is something we call hepatic veins. Now remember I said hepatic veins. There are 3 hepatic veins. I'm sure you are aware of that. We have what we call the right hepatic vein, okay, draining most portion from the right side, okay, right lobe of the liver. Then we have left hepatic vein. Then we have, of course, the middle hepatic vein, Okay, so all those guys, okay, are going to drain their content to the terminal portion of this inferior vena cava. Okay, so that's one thing. Now, the blood eventually gets into what we call the right atrium. But don't forget also, yes, if we are talking about inferior vena cava, we are also talking about superior vena cava also will be drained into this area of course, the right atrium. Okay, the deoxygenated blood from the head radius, okay, coming in here. So now, the point is that the oxygenated blood, okay, now you see that most portion, although I began that initially was oxygen poor, because it's meeting the oxygen rich blood from here, okay, eventually to be reddish. And then also the oxygen rich blood and the nutrient rich blood, so oxygen poor blood by way of the nutrient rich blood over here, and then some bit of oxygen rich blood doesn't spend much time in the liver, so that one is also a bit oxygen rich. So essentially, the inferior vena cava will bring it into a right atrium oxygen rich blood, and then some deoxygenated blood from the head region where it's not much, okay, will blend with it. So essentially, a lot of oxygen in the blood, okay, so you get here. And one thing that we see is that the pressure, because we have a lot of oxygen-rich blood getting into the chamber of the right atrium, what we see that the pressure over there becomes very high compared to that on the left. In intra-atrial life, that's what we see. And that is exactly opposite to what happens in extra-atrial life, where we have the pressure to be greater in that of the left side compared to that of the right side. Okay, so it gets here. And then what we see is that we also don't want, now remember that the initial thing that we said was that the lungs are not capable, okay, to deal with the stress of the circulation. Okay, and so what is going to happen is that usually we expect that the blood in postnatal life, we expect that the blood from the right atrium should get into the right ventricle. And of course, we know that from the right ventricle, the blood will be pumped, okay, will be shunted into what the pulmonary trunk to eventually get to what we call, divide into left and right pulmonary arteries and then to the lungs. We said the lungs are not ready to deal with that, okay, and so that is why there's another shunt system. Remember that the fetal system is all about shunt systems, and so that is why there's going to be another connection. Okay, now this is what we call the left atrium. Okay, of course we are going to have the right ventricle, left ventricle over here. Okay, so we want to shunt the blood, okay, from the right atrium, the pressure over here is very high, to that of the left atrium, through that opening, and that's the third and final shunt system I want you to become aware of, and that is the guy over here, which we call it foramen valley. Okay, so I want you to put it also in this manner. So these are the three shunt systems. You've seen ductus arteriosus, foramen valley, and of course, we also talk about ductus venosus. So now, this is the entire thing I want you to become aware as far as, okay, fetal circulation is concerned. Now, to go over it again, I'm not going to begin this way. Let me begin in the opposite manner. So if I begin here, what will happen is that we are having the placenta, and the placenta is bringing blood, quick blood, oxygen-rich blood, okay, from the mother's circulation, okay, and it's getting into the fetals, okay, 8 major organs via what we call this left umbilical vein, okay, so oxygen-rich blood. Now we said that the liver metabolically is very active, okay, as I even told you, the fetus, its cells, they are very active, and metabolically, the liver is a very active site. So we want to significantly bypass blood going into the liver. And so that is why the oxygen-rich blood, it will take a channel. Now from the liver, okay, the blood will have to get into what we call the inferior vena cava. So immediately there's a bypass channel, which it doesn't want to go to get to the liver. So immediately let me use a channel to get to the inferior vena cava. After all, from the liver to get to the inferior vena cava, that's the point. And so getting to that point is through one of the shunt systems. And the shunt, because it's a vein, okay, umbilical vein, which was carrying the oxygen-rich blood, the shunt system is called ductus venosus. Okay, eventually into the inferior vena cava. Remember that inferior vena cava is bringing oxygen-poor blood. But at this level, because a lot of oxygen-rich blood has got here, that's why I'm using red to demonstrate this area. That's number one. Although we are saying that significantly, the blood is going to what we call the inferior vena cava, it doesn't mean that we leave the liver out. No, the liver also has cells, okay? So it needs to get this oxygen. And that is why some portion the termination of this umbilical vein, yes, will still get to the liver. And that is something which, when it gets there, the liver will make, okay, the cells will, use it for its own metabolism. But one thing I want you to know is that the terminal portion, get the liver, okay, will be joined by what we call the hepatic portal vein, bringing nutrient-rich blood. So that one is oxygen poor. That's why I've used blue. Join it here and eventually get into the liver. But it doesn't spend much time. That's the key point over here. That's what I want you to know. It doesn't spend a lot of time so that there won't be marked effects, okay, as far as bioavailability is concerned. And then eventually, once it is done with that, quickly, it wants to also get into the inferior vena cava again. And we said that we have 3 hepatic veins. 3 hepatic veins. Not portal, 3 hepatic veins. So we have the right, we have left, and we have the middle hepatic veins. Eventually drain into the terminal portion of the inferior vena cava. So that one will also be relatively oxygen rich. And then finally, from the inferior vena cava, that blood, which is oxygen rich, gets into the right atrium of the heart. That's the point. Don't forget that superior vena cava too. This is SVC, superior vena cava. There's some bit of oxygen poor blood is coming from the head region. Okay, just that it's not that marked, so it blends with it, and eventually still we have oxygen in the blood. Okay, now the point here is that the lungs are not fully functional. So what do? You don't want to come significantly into the right, ventricle. So you want to bypass that, get it into what you call the left atrium through a shunt, and that shunt is called foramen ovale. Now, having said this, it does not mean that some of the blood will not get into the right ventricle. Some will get there. Of course, we have cells over there. So some of the blood will eventually come in here. And I want you to know that eventually some of the blood will get in here, into the right ventricle. And then from the right ventricle, where is the blood going to? It will be pumped into what we call the pulmonary trunk. Okay? It gets into the pulmonary trunk. And then eventually into the left and right pulmonary, arteries. But remember, that most of the blood, what will happen is that there's going to be a connection between the left pulmonary artery and the arch of aorta. We don't want to get to the lung so much, okay? And so there's another, shunt system into this time around the arch of aorta. So that significantly, we don't have a lot of blood getting into the lungs. But the point is that doesn't mean that some of the blood will not get to the lungs. Some of them will get there. And so when they get there, what will happen is that they will eventually, after the lung has made use of it, okay, now it becomes what? It becomes oxygen poor. So eventually it will come into, the left atrium through what you call the pulmonary veins. You know that we have 4 pulmonary veins. That's one thing you have to know. So it gets into the left atrium. Okay, essentially. Now when it gets into the left atrium, then eventually into, of course, the left ventricle. And then from the left ventricle, okay, that blood is pumped. Okay, remember that it's now oxygen poor. So a lot of the oxygen poor in there is pumped into what we call the arch of, ascend aorta, eventually to the arch of aorta, which also receives the blood which is coming from the left pulmonary artery. But the point is that in the cranial region, the oxygen content is relatively okay. But as we descend downwards, the cells are making use of it. And so the oxygen content will be decreasing. Okay, it will be decreasing. But the lower limbs can actually live with the oxygen poor blood significantly. But the important thing is that this oxygen poor blood, how will it get to the placenta? Okay, to be taken into, and then the waste, everything, how is it going there? And my friends, through a branch of what we call the internal iliac arteries. And what branch are we talking about? We are talking about the left and right umbilical arteries. There are 2 of them. And then it gets into the placenta. For that thing that we are talking about. These are the things. Now the point over here is that we need to know what happens to these important structures postnatal, because postnatally we are not going to use these ones. So after the fetus is delivered, okay, out of the mother's womb, then what is going to happen? After taking in air, what happens? The lungs become functional. So now pulmonary circulation will be established. Okay, now significantly, the blood can get to the lungs for that oxygenation. Now let's look at something. Let me start from here. The ductus arteriosus, which was shunt, because now the lungs are fully functional, then we don't need to significantly shunt the blood. okay, from getting to the lungs. We can leave it. So this guy will get obliterated. It will get obliterated, and I'm going to use this black thing to cancel it. It will get obliterated, and it getting obliterated. Okay, postnatal, we see it as the remnant. Okay, the remnant will be there, and that becomes something we call a ligament. And that is something simply we will call it ligamentum, arteriosum. Okay, it becomes a ligament. So we call it, let me use blue color to show it. It becomes a ligament postnatally, and we call it ligamentum arteriosum. Okay, so please look at it. Now, there was ductus arteriosus. So I say US for US, ductus US for US. Now it becomes ligament, and we call it ligamentum arteriosum, UM for UM. Okay, good. Now what else happens? Over here, we get down here, we don't need the blood to get to the placenta again. For this reason, that ocean poor blood will not be getting to the placenta, it's going to the lungs. Okay, for that pulmonary ventilation to take place, and eventually at the level of the alveolar capillary bed, the exchange will take place there. And so we don't need these left and right umbilical arteries. So that one too will get obliterated. And then getting obliterated, it will form what? Now, one thing that I want you to become aware, which, I've seen that oftentimes you are told that, they will become left and right, okay, medial umbilical ligaments. Now, I want you to understand, there is a catch over there. I want you to understand. Now, some people say medial, left and right medial umbilical ligament or folds. No. The ligament is different from the fold. The ligament is deep to the fold. Okay, so what you see over there is the fold. When you remove the fold from it, you see the ligament. So precisely what I want you to say is that it will form what we call the left and right medial umbilical ligaments. Which postnatally, what we see is that it's covered by a fold. And that fold becomes the medial umbilical fold. That's one thing. But there's another catch over there. There's a bigger catch. The catch is that it's not the entire extent of the left and right umbilical arteries that become the medial umbilical ligament. No. My friends, it's just this portion. Okay, so if you look at it, the initial bit over here, the initial bit, let me talk about it over here again. Now, good. Postnatal, we see that there's an artery, and the artery is called superior vesical artery. Now, whenever we talk about vesical organ, it got to do with the urinary bladder. And so the initial portion, the proximal portion of these left and right umbilical arteries will give rise to what we call left and right superior vesical arteries. Which means that if we talk about the medial umbilical ligaments, they will arise from the distal portion. Distal. So I want you to become aware of that, the distal portions of what we call the left and right umbilical arteries. So the point is that what I want you to know is the fate of these guys, they are two. One of them, it will persist. So the fate, they are two. One of them is that proximally, okay, we are going to see that it will give rise to what we call the superior vesical arteries. But distally will give rise to what we call the umbilical medial, medial, left and right medial umbilical ligaments. Okay, so I want you to become aware of that, medial umbilical ligaments. Now, having done that, the next thing is that we saw that there was a vein, a single one, left umbilical vein. Now, this left umbilical vein is just a single one. Now, look at it. It's going towards where the liver is. So it got something to do with the liver. And that is why, okay, it has something to do with one ligament of the liver. That ligament, which is found in the lower free margin of a falciform ligament, and my friends, that is something we call the round ligament of the liver, ligamentum teres hepatis. So I want you to become aware that this umbilical vein, I'm talking about the left umbilical vein, will become what we call the ligamentum teres hepatis. Okay, so that becomes your next thing I want you to know. Now we said that there were shunts that we wanted to bypass, okay, the blood should be going to the liver, okay, but we want to bypass it so that it gets to the inferior vena cava, eventually to the right atrium. But the point is that this guy over here, this shunt, postnatally will also go away. Let me use this thing to cross the umbilical arteries will go away, and that's the remnant we see. So this guy too will go away. Ductus venosus will go away. And that is the one we said is going to be, something. So it's going to be a ligament. And it's also venosus. So just like we saw over here, ductus arteriosus will become ligamentum arteriosum. This guy over here will become ligamentum venosum. Ligamentum venosum. Ligamentum venosum. So that is what we find over here. Now, the next thing that we are going to see, okay, is that we saw something, that there was a shunt system over here. And we said that shunt system is foramen ovale. Okay? Yes, so that the blood where is often recruit gets into the right atrium is shunted to this portion. We don't want it to come significant to the right ventricle so that it gets into the pulmonary trunk, into the lungs. We don't want that. Now, right now, the lungs are functional, so we don't need any shunt system. And that is why this guy too, by way of the foramen, ovale, will also get obliterated. So that its remnant is something which will form, which will become something we call, fossa, okay, depression over there, fossa ovalis. Fossa ovalis. Okay, so that is what we are going to see. So, one thing about this fossa ovalis is that some people, it fails to, fuse to form this fossa ovalis, okay, so that it becomes patent. And that's an important precursor, okay, because as far as atrial septal defect is concerned, there's a major, precursor to it, okay, non-closure of the foramen ovale to form the fossa ovalis. So, ladies and gentlemen, I hope you find this meeting helpful. Okay, so once you can really appreciate this concept, okay, then you can really talk about all that will happen, okay, as far as the fetal circulation is concerned, and then all the things that we expect to see, okay, postnatally, by way of the remnant, being ligament and what have you. Have a good night, all of you, and may the good Lord richly bless you. Amen.